There are many other cardiac emergencies besides patient having chest pain. Those can be anywhere from a stroke to cardiovascular disease to angina, and we'll go through each one of those. So, angina is just pain in the chest from caused by ischemia. The patient may have a coronary artery disease, also known as CAD. And when you see CAD in the chart, you know that the patient has known coronary artery disease. This patient may have had nuclear stress test or cardiac cath in the past that showed some blockage. This patient is at higher risk for having a heart attack. They also can have angina on a regular basis. Angina is chest pain caused by ischemia. So, a patient who comes in with coronary artery disease, once again, you're going to immediately hook them up to a cardiac monitor, get vital signs, do an EKG, draw blood unless nursing is going to draw the blood. If nursing is going to start an IV line, there's no reason for the ER tech to draw the blood because we don't want to stick the patient twice. Sometimes it does happen, but it is preferable that the patient only gets stuck once. Now, if nursing is a little backed up, you're going to want to go ahead and do a peripheral draw so that you can get your iStat blood work into the machine to start processing so we know what's going on with the patient. The patient can also be having a myocardial infarction, which is a heart attack, or they can have myocardial ischemia, which is just not getting enough oxygen to a certain part of their heart. Myocardial infarctions are medical emergencies and they need to be tended to immediately. Also, with cardiovascular disease, the patient could be having a stroke. And from my experience, I've found that most patients that are elderly are unaware of the symptoms of a stroke. So they will come in and they are in total disbelief that there's any probability or possibility that they're having a stroke. Symptoms of a stroke can be something such as slurred speech, facial droop, eye drooping, inability to say the correct words, right or left sided weakness. They might not be able to move either the right or the left side. Their speech can be garbled. They can also have visual disturbances where they can't see anything if they look to the right or if they look to the left. They have kind of a weird tunnel vision. So some people don't even have a clue that they're having a stroke. Remember that a stroke is a cardiovascular incident that is affecting the brain, and every minute that goes by, there's the probability that there is oxygen depletion to that area of the brain. So, what our role in the emergency room is to diagnose the problem and get the patient treated as quickly as possible in order to preserve their brain. Just like with a heart attack, we want to get them treated as quickly as possible, identify the problem, get them treated so that they can get revascularized, i.e., getting blood flow, which produces oxygen back to that area of the body. So, with a stroke, when the patient enters the emergency room, you're going to immediately hook that patient up to the cardiac monitor, get vital signs, prepare to take that patient to the CAT scan machine. And the air tech would transport them because it is a medical emergency and they need to have a CT within as short a window as time as possible. We have 3 hours from the onset of symptoms to get the patient the clot busting drug for them to have minimal or no damage. So we're working on a real quick turnaround time. So they need to have their blood drawn and EKG, everything happening very, very quickly. And as soon as CT can take them, the ER tech is getting them down the hall to CT because they have to have a CT of the brain to determine whether they've had an ischemic stroke, meaning a stroke that was caused by a blockage, or a hemorrhagic stroke. A hemorrhagic stroke is caused by like an aneurysm where a vessel would actually burst in their head, and they would have a little bleed. So we want to send them to CT. We want to make sure that there's no blood in their skull. And if there's no blood, then we can immediately get them back to the main ER and administer the clot busting drug. Now, think for a moment, if you had a small bleed in your head because you had a little aneurysm and it leaked, and now I didn't properly diagnose the CT scan and I give you a clot busting drug, what's going to happen? Exactly. It's going to eat the clot that stopped your brain from bleeding, the vessel in your brain, and you're going to bleed out and you're going to die. So we have to have an immediate CT to make sure there's no blood so that we can determine that it's an ischemic stroke and then give the blood, the clot busting drug. Obviously, the ER doctor would order that and nursing would administer it. However, the ER tech's role again is monitoring vital signs, getting the patient promptly to CT, staying in CT with the patient. So as soon as the CT is done, get them off the CT table with the CT tech and get them back into the main ER so that the results can be looked at and the patient is in the ER ready to get the drug if necessary. So strokes are a medical emergency. They need to be taken very seriously and we need to treat them very quickly.